to be here in my first time in India, a nice country. So I'd like to thank the committee for inviting me to visit this amazing country with amazing culture, amazing food, and that's my first time here. So I'm going to talk a little bit about the Brazilian perspective on transplantation. I have no financial relationship with any commercial interest in here. So to share some of our population is not as large as the Indian population. We sum up all the Latin American population, we are about 6,600 million population. Brazil is the largest country with 200 million population. So we are a country with 26 states and one capital in Brasilia. We are divided by 5 regions, and we have the largest public transplant system in the world. So we are 3 times larger in territorial area than India is, but we have a very short population compared to India. You guys have 7 times our population. Our GDP is almost the same as the Indian population, but our per capita GDP is higher than because we have a really low population. But we are really kind of the same kind of berries. We work with really limited resources in kidney transplantation. So I think we have a lot to learn from each other. So we have 269 organ transplant programs around the country. We have 1,991 hospitals with more than 80 beds, so all of them can have an OPO working. So but we have only 509 OPOs working actively in our country right now. We have, out of 27 states, we have 24 doing kidney transplants. So we have 3 states that are not doing any kidney transplants. And we have 154 kidney transplant programs active in our country. Well, out of the 155 kidney programs, only 16 are doing more than 12 kidney living donor transplants a year. So this is an issue. We're not doing very much good in living kidney transplant in Brazil. As Vivek showed here, we are the 4th largest number in kidney transplants around the world. When we compare to America, we need to grow our numbers, just like US and Canada. But Brazil is just a little bit like the south and the central part of America. We are doing a little bit less than Argentina, but a little bit more than the other countries in Latin America. So I'd like to show you the development of the transplant system in Brazil. I can divide it. When we first did our first kidney transplant in 1964, the first area we could call the heroism area. When the first kidney transplant was held, we had no organization, no funding, no legislation until 1988. 1988 was a very special year because that's when we started our national health system, the public system, where everything started to grow. So we initiated regulations, we did our first procurement deceased donor, we implemented our Brazilian Transplant Society until 1997, when it became the first legislation on transplantation in our country. So we are a very young country on transplantation. We only had legislation from 1997. So when we started organization, when we started funding, and when we started education around Brazil. So before the legislation, we did less than 5 deceased donors. We had less than 5 deceased donors per million population. And then we started growing until we are almost heading 20 donors per million population. But in numbers of kidney transplant, as you know, we started doing only living donors, and then in 1989 we did the deceased donor, and we, like everyone in this room, struggled with the COVID. We had numbers going down almost 40% of our transplant. That was really bad, but we could recover, and last year we got a new record on kidney transplant with more than 6,000 transplants last year. Well, was last week where the Minister of Health, Dr. Alexandre, presented us the numbers and the new guidelines of the Brazilian transplant system. I can translate this. Last year, the Brazilian transplant system, the public system, spent more than 1.4 billion reais. This is approximately $300 million on transplantation. So everything is paid by the government. The surgery, the medications, the pre-transplant evaluation, everything is free. So the Brazilian model of organ donation transplantation, it's public, universal, and every Brazilian has the same chance to get a transplant. There is no difference if you are living in a different city, if you're a different color, if a different culture, a different religion, they have the same chance of getting a transplant. So Brazil offers a universal free transplant through a public health system. The national transplant system regulates all stages, from donor identification to post-transplant follow-up. All procedures, medication, and logistics are fully funded by the public sector. Types of donation. We have deceased donors and living donors. The deceased donors occurs after brain death confirmed by 2 independent physicians according to the national medical criteria. Donations require family authorization. Brazil does not use presumed consent. We tried this in the beginning of our 2000 years, but we had struggled with the numbers coming down. So we came back to the presumed consent of donation. Living donation is allowed between relatives up to 4th degree and between the spouses. For unrelated donors, it's required evaluation of the state transplant center, the state level transplant regulation, and we need also judicial authorization. Well, we are organized in a structure with the National Transplant System that establishes all policies, authorizes all hospitals and teams. So every hospital in Brazil to be able to do a transplant has to have the National Transplant System authorization. And he managed also the National Registry. So every patient to be transplanted in Brazil has to be registered in the National Transplant System. National transplant states oversees local waiting lists, so they are responsible for the local state. Each state has their own waiting list and coordinates the allocation on the state level transplant centers. So we have the organ procurement organization that they identify potential donors, approach family in hospitals. We have the hospital donor teams conducted by donor management and family interviews. We have also allocation ethics. Organ allocation follows a single national waiting list based on medical urgency and compatibility. So the Brazilian transplant system has the same allocation all around the country. So first, all medical urgencies come to the top, and then for the kidneys, compatibility, and then time on the waiting list. And the organ is allocated by first they offer in the state level. If there is no organ, no patient to receive the organ in the state level, they go to the regional level, like south, north, southeast, central west, like this. And if there is no recipient in this region, they go to the national level, and then the organ can go to whatever there is a recipient for it. The process is transparent, traceable, and audited. Ethical principles include gratuity and prohibition of organ trade, anonymously between donor and recipient when there is a deceased donor, equity, transparency, and non-maleficence. This is the number of deceased and living donors per million population since 2011. As you see, we have grown the number of deceased donors in Brazil, but we came down with the number of living donors in Brazil. So this left us with the same gap that we need to do in transplant for the last decade. So we need to do 60 transplants per million population. And we still with a gap of 30 transplants per million population for the last 10 years. But although we are growing up, we have very differences in the numbers of organ donation in Brazil. As you can see, we have states doing as much of donors just like Spain does, just like US does, in the south of Brazil. And this very interesting, we have one state in the north of Brazil, in Amazon, that does not do kidney diseased transplant, but they have numbers of donation just like Spain. That's really crazy, but they can ship the kidneys to the other states so we can use them. And this is the number of kidney transplant per million population in Brazil by state. As you can see, the south and the southeast part of Brazil does better numbers than the north of Brazil and the northeast of Brazil. So this is the difference that we are now trying to face and try to reduce the disparities of organ transplantation in a country with like a continent is the size of a continent. So this is how the kidneys have been shipped for the last, between 2019 and 2021, when the kidney was not used in the same state, they traveled to the other states. So this is how it works. Most of the transplants are shipped between the south, but we can get transplant being from the north to the south, to the northeast, to the south, to the southeast, and so we can use the organ wherever there is a recipient for it. So then now, last week, we launched the National Transplant System, launched the National Policy on Organ and Transplant Donation objectives. So our objectives now is to increase the donation and potential donors, increase the rates of family authorization for donation. We have now approximately 42% of families saying no to donation in Brazil. It's higher than we could expect. Increase the rates of effectiveness of donation, increase the number of transplant performed, and to ensure that the waiting list of corneal transplant does not exceed 60 days. So this is a very special photograph that I have here to show you guys. We are now doing the next steps. We think that doing so many poor number of living donors, we need to start doing paired kidney donation in Brazil. And in this photograph, there are two people that I would like to public thank here. Is Dr. Michael Riss, that is helping us to develop our national transplant program in paired kidney donation, and Professor Alvin Ruth, the Nobel Prize that is also working with Michael in this process with us in Brazil. So we have now engaged to change the law in Brazil. This is the Ministry of Health. This is Dr. Medina. As almost know, most of you know who he is. He's the largest kidney transplant program in the world. He's doing more than 1,000 transplants a year. And this is the Ministry of Health and the president of ABTO, Dr. Luciana. She's a liver transplant surgeon. And in the far left, my left, there is the deputy, the person that will help us change the law in Brazil. So this is what we are trying to do now in Brazil. So to sum up, Brazil's model is public, federal centralized, and family consent based, built on ethical principles, equity, and transparency. It prioritizes trust, education, respect for family decision, ensuring one of the most successful public transplant system. This is our part of our transplant team when we had the visit of Michael Riss and Professor Alvin Ruth on the left, when we did our first three-way paired kidney donation exchange in our transplant center. I'd like to thank all of you for being here today. Thank you very much.